Hey guys, welcome to the Restoring Nurses podcast. My name is Matt. I'm a nurse on a journey to learn what it means to take better care of my entire life and on a mission to bring as many nurses with me as possible. I am a speaker, author, and coach. I give nurses the tools they need to build the lives they want to live. Today, I want to talk about work health. This past weekend, I gave a speech at a pinning ceremony for a university not far from where I live. And one of the things that I talked about in that speech was work health. I think that there's this belief in nursing that work can't be healthy, that work is almost a four-letter word. I mean, it is a four-letter word, but does it have to be? So the question is, can work be healthy? And I'm looking at my book, The Restored Nurse, and some of the stuff that I wrote in there. If you haven't picked up a copy of that yet, go to Amazon, search The Restored Nurse, or I'll put it in the episode notes below. So get the book. Many of you know that I often talk about self-care. And when we talk about self-care, unfortunately, what we often do is separate work from life. And here's the reality. We spend way too much time at work to treat it as if it is some separate entity that does not affect our life. Yet we tend to do that. I think we remedy that by being intentional about building work that is healthy. But what does that look like? Well, I think many of us believe that work is just an unfortunate reality. But here's the deal. As a Christian, the Bible says that work is good. The Bible talks a lot about work. The Bible goes so far as to say if a man won't work, he shouldn't eat. In the Old Testament, it spells out specific rules for when and how often and how much people should work. Now, granted, in the New Testament, modern Christians, after Jesus came and died and was risen, we're no longer bound by the Old Testament law, but it's still worth noting that the Bible does talk a lot about work. So work is a good thing. So what do we do to make work healthy? For starters, we've got to seek work that is balanced. Now, work-life balance is kind of a big buzzword. It's very popular these days to talk about work-life balance, and I personally think that work-life balance is kind of a myth. Well, at the very least, it doesn't look like what most people think it looks like. The reality is, and on average, nurses in America work 36 to 48 hours a week. That leaves 120 to 132 hours per week that you're not at work. Now, if we then figure 8 hours of sleep per night, which most of us are probably not getting, but let's say an average, I normally get somewhere between 7 and 9 hours of sleep each night. So let's call it an average of 8. If we subtract that, that's 64 to 7. That still leaves 64 to 76 hours of life when we're not working and we're not sleeping. Granted, there's time during the day that we spend prepping for work, getting kids ready for school, et cetera, et cetera, et cetera. But here's the deal. We cannot look at the 36 to 48 hours per week that we're spending at work and blame that for the entire rest of our life being a mess. We've got to own the fact that in the grand scheme of things, work is a relative small piece of the pie. Y'all, my dog is being kind of crazy. So if you hear any noise over there, that's just my dog barking at who knows what. Uh, but seriously though, work-life balance, I think it looks a little different than what most people think it looks like. I think it's more about seasons in our life than week to week or day to day, trying to balance the scales of work and life. But we do have to do work that is balanced. And part of that means answering this question. How often, on average, how many weeks per month do you work over 40 hours? If you are on a regular basis working more than 40 hours per week, then your work is not balanced. But Matt, I have to do that to pay my bills. I hear you. I hear you. I really do. Okay. But let me ask you this. Do you have a plan that gets you through that season so that at some point you don't have to work that anymore? The other thing I would ask is, Do you have to pay those bills because you've built a lifestyle that requires it? Are you choosing to drive a new car or a fancy car that requires you to work more than 40 hours a week on a regular basis? If so, get rid of the dadgum car. Lower your lifestyle so that you don't have to work that much. You will, in the long term, be much happier with a nice used car that maybe isn't as fancy as what you would want, but then not having to work more than 40 hours on a regular basis. So, next, work that fits your life. In nursing, we work strange hours, right? 12-hour shifts. We work late, we work overnight, we work late, we work holidays and weekends. But here's the deal. If you are going to build work health, you have to choose work that fits your life and not the other way around. Now, if your life works with you working 3 12-hour shifts, dude, freaking go for it, man. That's awesome. Me, however, my life didn't work that way. I got to a point in my career after many years of working 12-hour shifts that I wanted to be home for to have dinner at 5 o'clock or 6 o'clock every night with my family. I knew that when my kids got into high school and started getting really active in events and stuff, that I was going to be there for every single thing. I was going to be there so much that they got annoyed with me. That was my commitment to them. Well, the reality is they never did get annoyed with me. They were always my son, who's now 22, always seemed quite happy that we were there. And our daughter, who's 15, about to go into her sophomore year, she legitimately seems to enjoy having us there. And we are there all the time. But that meant that I had to do a Monday through Friday, 8 to 5 kind of job. And you know what? I chose jobs that fit my life. Take some time to consider the life you want to have and then choose work that fits that, not the other way around. Don't try to adjust your life in order to fit work, thinking that you don't have any other choice. It's just simply not true. Next point is do work that you love. I remember when I was working at the cancer center, I freaking loved that work. It was probably the most fulfilling work that I've ever done as a nurse. And when I talk about work you love, I'm not talking about a job you love, because you can do work that you love and hate the place you do it for. You can hate the place you work while still loving the work that you do. When I was at the cancer center, it turned out to be a difficult situation that eventually made me seek other opportunities. And yeah, I'm being very, very diplomatic. But here's the deal. I had to get out, but I loved the work. I loved being able to laugh with those cancer patients, being able to teach those cancer patients. I remember one of them looking up at me. She was in every couple of weeks for her treatments, and as I'm walking up with these recliners in this infusion center that we would do their infusions in, and as I'm walking up to her chair, she's looking up at me and she's smiling, almost laughing even. And I'm kind of like, this is weird. You're about to get chemotherapy. Who's laughing at chemotherapy? But she looks at me and says, she looks at me and I ask her, I'm like, what's going on? What's so funny? And she looks at me and says, you make this easy. She told me that I make chemotherapy easy. I mean, who says that? Okay. I loved that work. For most of the time that I was in the ER, I loved the work I did. Find work that you love. I am not telling you to accept abusive situations in order to do work that you love. When my time at the cancer center became unhealthy for me to continue working there, I left. And you may have to leave work you love in order to be at work that is healthy. But here's the deal. Do that, but then seek out new work that you love. For a season, you may have to do work that you don't love, and that's okay. That's okay. Find work that you love and do that. Work that fulfills you. I'm going to read this definition here that I got in my book. It says Merriam-Webster equates fulfillment with being satisfied. Does your work satisfy you? Some might even call it work that feeds you. Others may say work that gives you meaning or worth. Those are all the things I'm talking about when I say do work that fulfills you. As I told the students or the graduates, not students anymore, they've now graduated from nursing school. As I told the graduates this past Saturday, if the work you do doesn't mean something to you, it will be harder and harder to continue doing it year after year after year. Yes, you can do it. But who wants to spend that much time at a job that doesn't mean anything to you? Do work that is fulfilling and insist on work that is safe. There's kind of this narrative going on now that some people outright say it. I've heard people in the public and even family members of nurses just outright say that physical, mental, and emotional abuse are a normal, expected part of nursing. I've been a nurse 24 years, and I promise you, those things are not a normal part of nursing. Don't ever let anybody tell you that they are. We have to insist on work that is safe. I've heard stories of nurses being physically abused, battered at work, and their hospital's telling them not to press charges. Here's the deal. The hospital can't tell you that. You have the right as a human being, and at least in America, the right as an American citizen to press charges regardless of what that employer says. Now, does that mean that your job may be in jeopardy if you do that? Well, the employer that would tell you not to press charges may also put your job in jeopardy if you do press charges. And you know what? They're doing you a favor. I have been employed since I was 16 years old and never been without a job. I have had numerous nursing jobs, never without any gap. If you are an experienced nurse, you will be able to find another job. Now, it may not be a job that you want. It may not be a job that fits your life, that is fulfilling, that is all these other things, but that's okay because it's a season that's getting you between a job that is unsafe and work that is safe, fulfilling, fits your life, all these other things. So let's go back and consider some of the questions that go with each one of these things. Talked about work that is balanced, and I already asked this one. On average, how many weeks per month do you work more than 40 hours? Work that fits your life. Consider this question. In the past 3 months, how many times have you missed personal or family events because of work? There's a certain amount of that is required for nurses. When early in my marriage, I've been married 28 years, I've been a nurse 24 years. Early in our marriage, before we had kids, or even when our kids were young, I was working 12-hour shifts in the ER. We would alter our holiday plans in order to fit my work schedule. And you know what? That was fine when we didn't have kids or when our kids were younger. It was absolutely fine. It meant that sometimes Thanksgiving was on Saturday, okay? It meant that maybe we opened all of our Christmas presents on Christmas Eve instead of Christmas morning. If I had to work Christmas Day, it meant moving these things around. It meant that New Year's Eve was a holiday I almost never celebrated because I always chose to work so that I could have Thanksgiving and or Christmas off as well. So how many times in the last 3 months have you missed an event, personal or family event, because of work? Work that fulfills you. Consider this question. Ask yourself this, does my work fulfill me? Does my work give me meaning? Does that work mean something to you? Ask yourself that question. A work that is safe. Do you feel safe at your job? Not just physically, mentally and emotionally as well. Work health is a real possibility, even in nursing. And I don't care what anybody says. You can have work that is healthy, but it may mean making some choices that are better for you and your family, and choices that may be different than what most of the people around you are making. Thank you for listening to today's episode of the Restoring Nurses podcast. Listen, if you haven't already, go buy my book. It's on Amazon right now. Link will be in the show notes below, or just search The Restored Nurse. If you're a new nurse and you're seeing this, I wrote a book for you as well called Healthy Start for New Nurses. It has these same 6 pillars: work health, physical health, mental health, spiritual health, relational health, and financial health. But it's written to specifically the new nurse. So if you're a cranky old nurse like me, get The Restored Nurse. If you're a new nurse, graduated within the last year, Healthy Start for New Nurses is the book for you. It will help you to avoid a lot of the mistakes in work and life that myself and many of us other experienced nurses have already made and are now having to clean up. So go get the books right now, right now. And if you're not sure about them, you can go and download the first chapter from either one of the books from my website. Just use the link below or visit restoringnurses.com/social, and you'll see the links there for the free chapter 1 of each book, absolutely free.